Welcome back to Renergy. This is Dr. Carolyn Bowers, your doctor of physical therapy. This is where you come to discuss rehab and energy techniques and what it looks like in practical scenarios. And as I promised, I have a practical scenario for you today. So let's get started. One of my first patients was a cancer patient. I used the Renergy approach in the acute hospital setting. I was on the neuroscience floor. The patient was a middle-aged white male diagnosed with brain cancer. He was alone in his hospital room. His spouse hadn't arrived to the hospital yet. The nurses reported his spouse was difficult to work with, so it was probably better to see him alone. I entered the room and found him lying on his back and very still. Quickly, he began verbalizing that he probably wouldn't be able to work with me because at 5 o'clock his pain was usually very intense, even after receiving his pain medicine. And he was already nauseous when he tried to move. As you remember, back in 2021, I was just beginning to incorporate Reiki into my PT sessions. But I firmly believed that I could help this patient to mobilize if I was able to initiate a brief focus Reiki session, adapted from the traditional Reiki session, because Reiki could take quite some time, and in acute care settings, we really don't have a lot of time that we can allot to that. So you have to be a little bit more outside of the box and adapting of your technique. So this is something that I did. So let me give you a simple definition of Reiki. Reiki, it is a Japanese form of energy healing. It's a type of alternative medicine. It is something that is used to enhance a session if you're working with someone in a PT setting. Many of the Reiki practitioners use a technique called palm healing or hands-on healing, through which a universal energy type of a force is said to be transferred from the palms of the practitioner to the patient in order to encourage emotional or physical healing. I've always began my Reiki sessions when I was in the acute care hospital setting with my hands placed at the top of the head, where you would consider the crown of the head and what we would consider the forehead, or what in energy circles is called the third eye, are located. And I would work my hands down the body to the throat area, to the heart area, over the shoulders, over the hands. Then I would move to about 2 inches above the belly button, which would be the solar plexus area, and then 2 inches below the belly button, which would be considered the sacral plexus area. And then I would move towards bilateral hips, knees, ankles, and both of the feet. So after the patient agreed to allow me to see if he would respond to a Reiki technique, I placed my hands on his arm initially to show him what it would feel like. And he immediately responded with, "What was that?" I just felt that go down my whole arm. And he said, "Do it again." And he responded with, "Oh my goodness, I felt it again." He then gave me the go-ahead to continue. When we finished the session, he immediately looked up at the clock and said, "I normally need pain medicine right now, but I don't." He was so grateful and shared how he really loved feeling the touch, and how his spouse was wonderful and supportive during his battle with cancer. But he said that she rarely placed her hands on him. I was so grateful that I had the opportunity to witness or observe his response, and I was grateful I slowed down enough to hold space to hear his complaints or concerns and offer him something that enabled him to mobilize out of bed to the chair, ambulate short distances in his room, and then return to the bed to sit up in a bed chair position with a desire to eat, no longer nauseous. I knew then that Reiki had a place in the acute care setting, and I could help more patients by using it. So as you can see, Reiki definitely and energy work has a place in the acute care setting. Let's prepare for tea time. I'd like to talk with you and to share with you a little bit about in tea time is a value-based approach versus a productivity approach. I happened to go to a book reading during Black History Month this year where they were discussing the story of Walter Macmillan, which was a black man that was wrongly convicted and eventually was vindicated in that case. And during that conversation, during that book reading, there was a conversation brought up about value-based versus productivity-based care. And it was stated that there was a program for those who were incarcerated to help them to reintegrate back into society, that there was a push now within the healthcare system to go towards a more value-based system versus productivity, which would allow them to then enjoy and incorporate other types of care that would help support them as they reintegrated back into society, which could include things from a holistic perspective, energetic perspective, treating patients holistically in the sense that insurance is more open to that and they're becoming more open to that, and the model is moving towards this, where we are now able to look at mindfulness. You'll be looking and seeing things like in that mindfulness type of approach could be tuning, sound healing, meditation. All of these things are a part of the whole person. And this is one of the things that energy work can do and mindfulness can do. And so what it's doing now is allowing us to move towards what we would consider a value approach versus just a productivity approach of saying, see so many people get this done, get that out, but actually trying to help the whole person to be able to integrate back into society. Again, that was from those who are incarcerated trying to move back into society. But when you think about it today in the acute care setting, and everything a lot of times is focused on productivity, being focused on a value approach is really in the sense of what I do when I'm treating my patients, because I am looking at them holistically when I'm working with them, and I'm listening to my intuition as I'm working with them. And so I'm offering them more than just what we would consider the typical thing that needs to be done for productivity. That gets taken care of, but more importantly, when I see my patient as a whole, I get the opportunities to see the outcomes that I shared with you in my opening scenario with the cancer patient that I work with. So just keep that in mind, that we're in the middle of a shift again from a productivity focus to a value focus when it comes to healthcare. And we're right now in the middle of a gap where, when you transition from one thing to the next, it takes a minute for you to really see it. But I promise you, you keep your eyes on it, and there are going to be more things made available to you that have not been made available. According to Richard Gerber, MD, we are currently in the Newtonian era, which is more mechanical and surgical, etc. You're going to see us start to move into what we would call a Einsteinian approach to medicine, which is going to incorporate many things. As we know, Einstein's equation, E equals mc squared, right? Which is just the energy is equal to mass times the speed of light. And so we're going to be able to see within that and be able to view matter as energy. And that is where a lot of what I'm doing is going to become more visible, and it's going to become more apparent, because when energy, and which is a vital life force that we all have and we work with on a day in, day out basis. Dr. Gerber states, energy is affected by our emotions, spiritual balance or imbalance, nutritional status, environmental factors. There's all kinds of things that are influencing our energy and how it works within us. And that energy is significant to how we heal. And so that is why my approach to treating my patients, we're blending energy techniques in with my rehab techniques, is a sacred approach for me, for my patients, because I am seeing my patients holistically as well. So stay with us and you'll learn even more. I see you. So let me share with you. I had an opportunity after leaving the hospital last Wednesday to go to visit a store that a friend had invited me to. And it was called The Bag Lady. The Bag Lady is located at 1516 East 4th Street, Charlotte, North Carolina. You can go in there, and if you are interested or just are curious about different types of things that are available within the energy world of books and stones and jewelry and chimes, you name it, it's in there. It was such a good spirit and good energy inside of this store. And I had an opportunity to meet those that work in the store, that do the books. I found books that they have there on spiritual healing and in hospitals and clinics, vibrational medicine by Dr. Richard Gerber. It is a treasure of information and tools, and they've got anything you can think of that you might need when it comes to embracing different types of energy technique and work and spiritual enlightenment. It's an awesome tool. I was able to pick up some of their jewelry, some of their books, and some of their chimes. I love wind chimes. So I want to give a shout out to some of those that I met there. And in particular, Devon Brown. Devon Brown was behind the counter with Remy Steele, and he happened to speak something over me, and he said to me, he said, you need to be on YouTube, or you need to be out speaking. And I just smiled at him, and I shared with him about the podcast, and he looked at me with confirmation that that was what I was supposed to be doing. And he was really excited, and he said he looks forward to seeing me on YouTube as well. So be prepared. You might see us on YouTube. But I did just want to give a great shout out to the Bag Lady, and especially to Remy and Devon for being such great helpers and helping me find everything I needed. And I just want to send you guys that way. It's not far from the acute care hospital in which I work for. Again, that address is 1516 East 4th Street, Charlotte, North Carolina, 28204. And it's called The Bag Lady. Come there and find all of your intuitive gifts. They've got everything you can think of from an intuitive advantage. So please do stop by and shop and just browse around. You will enjoy yourself immensely. All right, guys, that's a wrap. We'll see you again next Monday. And when we see you next Monday, we're going to go in and we're going to talk some more and share some more patient scenarios. But we're also going to talk about that whole idea of non-duality and duality when working with our patients, and why it is so important for us to be there to observe our patients before we jump in and begin to treat them. Very, very important. See you then next Monday.